So this exposure is stop eating fish. Number two, don't have amalgam fillings. If you have amalgam fillings and you're pregnant, do not have the fillings taken out while you're pregnant or breastfeeding, but protect yourself on a daily basis from the mercury that is released from the fillings, which we do by giving moms a fairly good dose of chlorella, a nutritional algae, that they have to take with every meal, because it's during chewing of the meal that the mercury is released, and that the chlorella that you take at least captures the abraded mercury and some of the mercury vapor. And then for the mercury that makes it through the mucous membranes that is released, we recommend a high protein diet, which contains enough of the sulfhydryl-carrying amino acids like cysteine and glycine, and branched chain amino acids, leucine, isoleucine, all the amino acids that bind mercury when it's moved into the blood, which is after eating the next place where it goes. And so, unfortunately, there is no safe way of removing the fillings during the pregnancy, except with very, very few dentists that have really this procedure down to a degree where there's not a single molecule of mercury released anymore in the patient's system. So that is exposure number two, is the fillings and avoidance of that. Number three is living downwind from a coal burning power plant or from a chlorine manufacturing plant. These are some obvious things. Next number would be living close to congested traffic areas. Every time you're in a traffic jam in Los Angeles or in Seattle or wherever you live, you're inhaling, aside from the petrochemicals that everybody should be aware of, you're inhaling huge amounts of cadmium and other toxic metals that are still in the exhaust of the cars. Aluminum cookware we talked about. This covers some of the more important aspects relevant to the pregnant mother or to the mother with a young baby. The next exposure, I'd like to talk about some mycotoxins, molds. And the most important source for that is the home. There's much to be known about how to build a safe home. And here in North America, unfortunately, the building style is basically, the houses are like structured like plastic bags.
Petri dishes.
Yeah. Well, by law, the walls have to be airtight. That means they're not breathing. And if there's any water leak inside the house, through the roof, or through a water pipe, or through a spill of water, the water cannot go anywhere, and then combines with dust particles and various sorts of organic materials, it becomes a petri dish for the growth of molds. And once molds grow, they produce mycotoxins. That means they produce toxins that are meant again to protect their life, but also some of the substances they use to exchange with each other, to fertilize each other, their sperm basically, and informational substances, plasmids, little encapsulated pieces of information that are passing through the rooms, through the air with each other, have strong toxic effect on us. Many of them are neurotoxins that are extremely destructive to the health of a developing fetus. And fetal exposure to mycotoxins are absolutely devastating to the normal development of the brain and the central nervous system and so forth. Remember, they're not necessarily immunotoxins. They're direct toxic to the nervous system, directly interfering with the healthy development of the nerves. To minimize exposure from this, really the best advice that I can give is that every pregnant mother should get the local indoor air quality company into their house to evaluate it. Mold toxins are odorless, colorless, invisible, they have no taste, we do not know that they're there. When we smell mold, it is not the mycotoxins that we're smelling. Yeah, what we're smelling usually is mold, is material that's breaking down enzymatically from the action of the mold. So when you smell mold, that is not what's making you sick. Yeah, it's what you don't smell what makes you sick. And so this is a very, very important thing. And very often America has adopted a building style in the 1930s that was meant so every American can afford to have a home, but it's the lowest standard of safety and health that anybody could have come up with. You know, the walls don't breathe, the windows are located where they don't supply good aeration, the air ducts in the house are often mounted wrongly, so there is no proper ventilation in the house. And they're basically, most American homes are large petri dishes designed to make people sick that live in there. It's a form of population control. I come from Germany. You know, they've examined some homes that were 700-800 years old. They're still completely mold-free, because in those days it was known to build a home out of natural materials that breathe and let air go through, and they don't become a ground for the growth of microbes. Indoor air dust is a carrier for mold toxins, so if there's dust in the house, it increases the problem. That's number two. So treatment, get an indoor air guy in there to get a diagnosis. They check at moisture meters for the walls. They check the routing of the air ducts in the house, where the windows are located. Is it really providing a good flow of air through the house and so forth? They're looking at the dust count in the house. And they put petri dishes out to grow molds and bacteria to see what can culture inside the house. This is a huge issue that is not commonly acknowledged in the American population, nor is it acknowledged in the alternative medical group that I work with that deals with autism. Nobody seems to be talking about this enough. Yeah. So that's number two of the toxic exposures. Number three is the chronic bacterial, viral, parasitic infections that we have that creates a large array of different toxins. For example, the most common one in the intestine is called Ascaris. It's estimated that up to 60% of the American population are carriers of this. Nobody talks about this. Again, it's an unpleasant topic to talk about, especially with the Puritan background that you guys all have. You know, where these areas of the body that are involved with this are not talked about. Ascaris creates a toxin called ascaridine, which is a strong nerve toxin, kills teeth, creates bizarre behaviors in people, especially in children, often aggressive, violent behavior in boys, and very docile, placid behavior in girls. There's Giardias and amoebas, which are very commonly found in people, especially Giardias in all the rivers and lakes in the US. And Giardia creates specific toxins that are all neurotoxins, often creating more fatigue and immune compromises in people. So these are also immunological toxins. But there's a large array of bacteria which are very significant in Lyme disease. The most prominent one that I find is Streptococcus of the group A. It's the one causing tonsillitis. That creates, first of all, a large array of immune reactions. There's this process called molecular mimicry. The membrane of the strep bacteria looks very similar to joint membranes, but also very similar to myelin. And so once the immune system develops a response to the strep bacteria in the throat, it will also attack the joints, it will also attack the brain and the central nervous system. And depending on how well the immune system distinguishes between the bugs and the nervous system, more or lesser parts of the nervous system are attacked by the immune system, creating autoimmune type reactions in the nervous system and ultimately inflammatory changes in the brain, which we already have talked about. Now, the new bug on the block that is very, very, very common in autism is Lyme disease. Yeah? Lyme disease is probably the most common overlooked infection in autism, and certainly on its own, without the presence of mercury and any of the other more well-known problems, autism can cause a full-blown Lyme disease can cause a full-blown picture of autism. I've had several cases where simply treating the Lyme disease was the treatment of autism, the successful treatment of autism. Very briefly, it is now understood that Lyme disease, first of all, is a bacterial infection. It's a spirochete similar to syphilis. It's a bug that looks like a corkscrew. And it is found in all the fluids of the body, in saliva, in the semen, in vaginal fluids, and tear fluids. So simply kissing somebody can transfer Lyme disease from one person to another. That is still debated, but we've seen the cases. Sexual transmission, certainly. We know there is placenta transmission, so if a mom with Lyme disease is pregnant with a baby, the baby is fully exposed to it and born with Lyme disease, which often looks completely normal baby, and however with progressive age it gets sicker and sicker, usually neurologically. And usually it's about age 2 where the symptoms manifest more strongly and can take the full course of autism or the offshoots of autism, Asperger's, Rett's, and so forth. The neurotoxins from Lyme disease are extremely potent neurotoxins. So potent that even in grown-ups they cause full-blown neurological syndromes like multiple sclerosis, Parkinson, and all the things that we see from it. You know, so remember, some of these toxins are only toxic to fetuses and newborn babies because they're more vulnerable. Lyme disease is different. It is so potent that it also in fully healthy grown men athletes, it causes full-blown neurological disease pictures. Never mind in the fetus and in the newborn baby, it's devastating to them. It is so commonly overlooked that it is shocking to me. Since we know this issue, we've made the diagnosis on a lot of newborn babies, on a lot of children with the diagnosis of autism. And then the treatment, however, is difficult. It's not easy. And I am not taking the position that antibiotics are the best way to treat this. There are certain herbs and natural approaches that are far superior to the treatment of antibiotics. So I just want to say that here, that I'm not misunderstood. That doesn't mean we have Lyme disease, that means antibiotic treatment. No. It may mean that, but usually it does not. Then we have the viruses. And in autism, the most common viruses, there's 3 viruses that we find. It's the measles virus, usually given to the child through the measles vaccine. It's an attenuated, or let's put it this way, it's a poorly attenuated vaccine. That attenuated means the viruses are alive, but they're weakened. And however, they're not weakened enough, and even in people that do not go on to develop autism, we find live measles virus in many of the children that have been vaccinated with it, without necessarily causing autism. It may just cause GI symptoms for many, many years, or lack to thrive, or other lesser problems in autism. But as you know, the studies from Dr. Wakefield in England and his students have demonstrated in a large percentage of autistic children live measles virus in their small intestine, and it is an issue that has to be recognized and has to be treated. And with the treatment, we discuss it tomorrow in the different treatment options, but it's an absolute must to make the diagnosis on the next